An eye-opening milestone and Blanchfield Center's pregnant patients. This is the Regional Health Report. Welcome to the Regional Health Report for June. I'm Ann Krebs. Our first stop is Fort Eustis, Virginia.
Meet Dr. Michael Hamilton. He's the ophthalmologist at McDonald Army Medical Center. Recently, he performed his 2,000th eye surgery, which is a pretty big milestone for a military eye doc. For Dr. Hamilton, it's not the number of surgeries that's big, it's what the surgeries mean for the patients.
So there's nothing quite like taking people from blurry vision one day to great vision the next day. So I think it just kind of comes with a field. I think it's a great field for patient satisfaction.
Hamilton's skill and bedside manner are a big part of patient satisfaction.
He has an awesome reputation, and quite a few people told me about their experience with him. So that made me kind of comfortable.
The eye clinic treats service members, their families, and retirees.
We've all had a choice once you pay off your debt to the military to get out or to stay in. I chose to stay in just because of that. The patients were able to take care of.
Hamilton also treated soldiers while deployed. During his 180-day tour, he performed 188 surgeries.
I think after serving in Iraq for a few months, it definitely changed my view of that, and it is an honor, I think, to serve those that are protecting our country and their loved ones.
It was either get it done or keep seeing the way I was seeing. So I chose to get the surgery done, and I'm glad I did. Everything is so clear and so bright now.
Families at Fort Campbell, Kentucky are taking part in Blanchfield Army Community Hospital's Centering Pregnancy Program. Centering is an alternative prenatal care method. Fred Hawley shares the story.
Centering is basically group prenatal care. It's an entire group. You still get the one-on-one with the healthcare provider, but then once that is over, then we all center up in a group together, and there's different topics that we go over at every session, and it's an opportunity for not only moms to meet new people who are due around the same time they are, but they get to ask all kinds of questions and learn about their pregnancy together.
I got involved in the centering program. I learned about it through my first appointment here at Women's Health. They were handing out flyers, and I was like, oh, this sounds cool. I can learn things from other moms, and just like a one-on-one with the doctor, I can get multiple points of views from other women that are going through the same thing that I am.
With Centering, it's a program that's offered to anybody that comes to Blanchfield that's pregnant. We tend to gear towards those first-time moms that haven't been through this before, but anybody can come, even if they've had, 2, 3, 4 babies. We've had, those people in our groups as well. And really, it's awesome to have those women in there because they can share their experiences. Every group is so different. And then, the first couple sessions, they tend to be quiet. And then by the end of it, everybody's friends. It's really awesome.
They walk you through this whole process, and you get to see other people progress in their pregnancy as well. And then towards the end, they actually have a baby shower for you. And they're just very supportive. The instructor is very supportive, very helpful.
When it comes time for everybody to give birth, I think it'll be a great bonding experience when we all come back with our babies and see each other.
It's just a really good way for moms to get to know each other, have a support system, and then learn about their pregnancies together.
The centering pregnancy method has reduced emergency room visits and has led to a decrease in premature births. Patients feel more confident and feel ready for labor and delivery. In other news around the region, Ireland Army Health Clinic's Peter Mott recently earned the Excellence in Occupational Health Nursing Award. Mott was presented the award during the American Association of Occupational Health Nurses Conference in Reno, Nevada. To win the award, he earned the highest score in the nation on the Certified Occupational Health Nurse Specialist exam. Ozella Lee Gates, library technician at Dwight D. Eisenhower Army Medical Center, is the 2017 Federal Library Technician of the Year, as selected by the Library of Congress. She shows exemplary commitment to providing services to a multitude of medical center customers. Her name will remain on the permanent display at the Library of Congress. And finally, we want to say good luck to our soldiers at the Warrior Games. That's the Regional Health Report. Join us next month for another show highlighting healthcare across the region. In the meantime, don't forget to check us out on Facebook, Twitter, Flipboard, Pinterest, and YouTube. We're also on iTunes. Thanks for joining us.